But I think we're probably good to go. So good morning again, everyone, and thank you so much for showing up this morning and attending this webinar, which we're really excited to deliver on behalf of Zurich Club Blue and also Zurich Resilience Solutions. So welcome once again, and yeah, it's good to see so many of you on the call, and hopefully we'll find this next hour both interesting and informative. So I'll just do a little bit of housekeeping and a few intros, if that's okay, before we get stuck in. I'm Noel Dowds. I'm the distribution consultant over in the retail team here at Zurich UK. And it's my pleasure this morning to be able to host our webinar, our motor webinar. And it's all about human factors and fleet safety today, which I'm sure you're all well aware of, having seen the invite. I will just run through a couple of bits of info. So the format of today's session, we will have a presentation followed by Q&A. So if you brought any questions along with you today, or if you anything pops into your mind as the presentation is being carried out, please do raise those in the Q&A function, and we'll be glad to pick through as many of those as we can at the end. So anything pops to mind, please let us know. We are recording today's webinar, so just bear that in mind, and the benefit of this is that we'll be able to send around this recording once we're done. So if you have any colleagues who haven't been able to attend, any clashes or any other kind of issues in joining, then we'll be able to send through a recording afterwards. So we'll upload that to our YouTube channel, and so watch this space. We'll also be asking for some feedback towards the end of the webinar, which would be great to hear what you thought today. So without further ado, I will introduce our speakers today. We have the privilege of having Dr. Lisa Dawn and Alan Thompson from ZRS today to cover the content. So I will hand over to those two now, and yes, enjoy. Thank you.
Thank you. Alan, would you like to introduce yourself first?
Okay. Very much today, I'm sort of Lisa's not so glamorous assistant. I'm going to be very much supporting the event. I'm a motorist consultant with Zurich Resilience Solutions, so we work with your clients across the country and basically look to support them with all aspects of fleet safety, fleet compliance. So what I'm going to try and do today is support Lisa's presentation by monitoring the chat. So please put all your comments, your questions into there as we run through. Where it becomes relevant or where I can try and slip in the question, I'll ask Lisa relevant questions throughout the presentation, and try not to break it up too much. But that's me, and that's the role that I've got here today. So please, Lisa, over to you.
Thanks, Alan. And thank you to Zurich Club Blue for joining us this morning. It's I can't see you, but I'm sure you're all enjoying the day and looking forward to your weekend. And I'm looking forward to talking to you more about the human factor in fleet safety. My background is in driver behaviour. My PhD was in driver behaviour, and we are sorry, the slides moved. It's kind of thrown me off a little bit. So it's well known that driving for work is a very dangerous activity, and it's been my life's work to be involved in how to manage safety when driving for work, and that research has been going on for about 25 years now. I've published very widely in the topic, but I have two roles. One is as Cranfield University academic, where I manage the driving research group. Currently, we're doing research on automated driving and the development of trust. But I also have my own consultancy doing all sorts of research and interventions for managing road safety, to kind of do the work that is less academic, if you like, but more getting my hands dirty in the real world, looking at how to manage risk in the workplace. So from a side drive perspective then, a lot of the work we get involved with is around driver profiling and interventions for improving road safety. We're also a specialist provider of accredited training for road safety professionals. So many insurers and brokers have been onto my accredited course, which I'll tell you a bit about in a few minutes. But I have a well-established human factors capability. I'm a Chartered Institute of Ergonomics and Human Factors specialist, and I've been working in this in the field of human factors with the Institute for at least 15 years. So, without further ado, then, if we can have the next slide, and tell you a little bit about some of the work that I'm currently involved with, working with Transport for London on pedal confusion, issues around people driving for work when they hit the wrong pedal. They expect to be hitting the brake, but they actually press the accelerator. And there's been some very high profile incidents in London, which sadly have resulted in deaths and injuries. And so TfL are very keen to understand exactly what's going on in the brain, why it is that people get confused and press the wrong pedal. And my role is to design training interventions to manage that risk. Recently worked with the Association of Ambulance Chief Executives on the development of a wide-scale national campaign to encourage paramedics to belt up in the back of an ambulance, because again, there's at least one ambulance crashing every day, and unfortunately paramedics fail to wear their seatbelts, they fail to properly harness their patients, and the campaign was to encourage a behavioural change. With Dorset Police, I've been working with them for many years, designing their driver diversion schemes. So if ever you've been down in Dorset and you've been caught speeding, chances are you've been on one of my schemes. And with the Driver and Vehicle Standards Agency, I have written a book which is an official guide to better driving, looking specifically at human factors. It's only about 10 quid. I don't get any royalties, but I would encourage people to look more broadly at the human factor in driving rather than just focus on developing the skills. I've recently completed a project, a 2-year project on helping aid and development workers around the world to manage the risks of driving in some very challenging conditions, and working as well for a couple of years for Travis Perkins on bridge strikes, where there have been concerns about specialist vehicles going into low bridges, problems associated with stress and distraction, and also working with other companies on bridge strikes currently as well. All right, so moving on. And this is really around looking at some of the issues around work-related road risk. And with regards to work-related road risk, our slide hasn't come up properly, but I'll talk. There it is, brilliant. So less than 1 in 5 of driving for work fatalities was a person driving for work. In fact, most of the fatalities come from vulnerable road users. So really a lot of the unfortunate incidents that happen when people are driving for work is really around protecting those vulnerable road users. Clearly within an organisation, it's not just the deaths and injuries that need to be avoided, but it's also the multiple claims, the low speed manoeuvres, issues around reversing and third party hitting rear. These are some of the kind of bugbear in any organisation that can actually generate a huge amount of work in terms of administration, investigations, claims, and vehicles off-road, and all sorts of the additional costs involved. But the principle around here is that whilst there are so many fatalities when driving for work, what we really think about in workplace terms is how we really must focus on slips, trips and falls, dealing with hazardous substances and so forth. But actually, there's 3 times more people being killed on the roads than there are in the workplace, and yet we carefully control that risk. So we need to do more really around controlling those risks. And this is one of the reasons why we wanted to talk to you today about some of the ways in which you can do that. We know that human factors are a major contributor to work-related road crashes, but when it comes to managing that risk, many organisations don't really know how best to do that. So I'm now going to take control and move on to the next slide. One of the issues around the problems associated with the human factors in as a contributor to crashes is that when crashes happen, it's very compelling to look at what the driver did just before the event. So the tendency is to focus on the human error, look at what they did wrong, the fact that they did not comply with the rules and regulations. And all of these things are very visible when an incident occurs. But actually what isn't visible is what's below the surface. And that is what contribution the organisation is making towards those errors. You know, what are the gaps in the safety systems? What are some of the motives that mean that drivers are rushing around, not thinking about what they should and shouldn't be doing, but trying to get the job done? You know, so there often when we look at sort of further upstream from the incident itself, that there are management decisions that lie beneath the surface that we need to be cognizant of if we're going to manage safety.
Lisa, can I just come in and ask you a question there? I think it's also really important to recognise from the industry's perspective, and by that I mean the insurance industry's perspective, that we collate information which sits more at the immediate cause, so rear end collision, driver hit, static object, and those sorts of immediate cause solutions, whereas actually what we probably should be doing, I think is what you're alluding to, is actually dig deeper, go into what are the underlying causes that I mean, we probably know the term more of the root cause, but the underlying causes that actually create those inevitable consequences. And I think we as an industry need to get more slick at sort of delving and pushing clients to find that, because that's the only way to improve their performance moving forward. Apologies, Lisa. Yeah.
No, absolutely. You know, it's a very valid point. And so, for example, if the organisation has poor scheduling choices, where drivers are being sent to all parts of the country, you know, with an impossible amount of deliveries to make, and the kind of human factors not taken into consideration, what will tend to happen is that people will interpret that as, I've got this huge amount of work to do, and the only way I can do this is by speeding and tailgating, overtaking at risk, doing the kind of things that, you know, we know leads to crashes. Yeah.
I think also, Lisa, sorry, just on this, I think this is such an important area for us as an industry, because actually we're putting an awful lot of pressure on to supervisors who probably are given the responsibility to investigate these instances, some of which, you know, we'll look at, oh, it's a minor incident, they just reversed into a post. So actually we don't look at the standard that's actually applied to it. We just look at the outcome, rather than, you know, so if it's, well, they reversed into a pushchair, that's a very serious outcome, so that would be investigated. But reversing into a post, which is the same standard of driving, doesn't. Sorry.
No, please don't apologise. It's think it sort of enriches, you know, some of the issues that Zurich sees on a regular basis. So, yeah, very good. So what we need to do then is to take a systems approach. You know, we need to look at, you know, what's the evidence for interventions being able to improve fleet safety. You know, if you're just focusing on the kind of human factor without really thinking about, you know, what works and what doesn't work, and what these systems are that are in place that can actually tend to encourage human error, then, you know, really nothing is going to improve. And the question really is, well, are crashes adequately being investigated? You know, what, as Alan was saying, do we really take into account some of these reasons why drivers behave the way that they do? You know, can we actually rely on fleet drivers to follow the rules? You know, I'm sure many of you here will recognise that actually there is an incredible amount of non-compliance within your organisations. Otherwise, you wouldn't be having the problems that you're seeing from some of your clients. So the question is, what systems need to be in place for behavioural change, especially when it comes to safety culture? And some of the work that I've been involved with has been around, you know, interviewing drivers, listening to what they say, listening to what managers say, you know, how leaders are committed to safety or not. And this really is about, you know, what organisations do in terms of giving people's their contracts and, you know, their assignments. What is it they're expected to do? They may actually say, well, you mustn't speed, but workloads are too high and people do. So how does time pressure affect fleet safety, and what can be done to reduce time pressure? Ultimately, you know, what are the consequences for running late? And is there a blame-oriented culture which tends to create more negative kind of consequences for individuals? Some of the interviews that we've done kind of you can see very clearly how when an error has been committed that's led to an incident, and then it's something that's never been picked up before, even though the organisation were well aware that it was a problem, and then they feel quite resentful that it's not been managed, and yet they're now responsible for the incident. So some of the typical kind of quotes here: I think it's very unfair because they preach health and safety, but they don't follow it through. It's health and safety as long as the rules apply to them. It's your fault, period. If something goes wrong, it's not their fault. It's not their schedules. So, you know, these are some of the issues that has emerged in many hundreds of interviews that we've conducted in the past. So when we need to think about safety culture, we need to think about, you know, the ways in which you can categorize the level of the safety culture within your organizations that you represent. And one of the ways in which that's being done is through the safety ladder. And the safety ladder here is a way of kind of categorizing a safety culture within any organization. And there are techniques that enable researchers such as myself to be able to benchmark where an organization sits on this ladder, where with an increasing number of steps up that ladder, there is a more informed workforce and better organized system for managing safety, and more cognizance of safety. And you can see here at the very bottom of that ladder, we have the categorization of a pathological safety culture, one in which there is this general norm value around safety, which would be typical of hearing people saying things like, who cares if we get involved in incidents, as long as we're not caught, it doesn't matter. Who cares if we do things wrong? It's very pathological. Further up the safety ladder, we move to reactive. Safety is important. We do a lot every time we have an accident. So in other words, it's very much around after the horse has bolted, it's like, oh, what happened there? Let's see what we can do to fix it, which of course is a very reactive rather than proactive response. And then at the calculative level, we have systems in place to manage all hazards. So it's very much kind of keeping on top of safety. But at the proactive level, here an organisation is actively searching for mistakes that could emerge, that problems that could lead to incidents. And this is very typical of a very good safety culture, and typical as well within the safety critical industries like gas, petroleum, pharmaceutical, that kind of industry. And then finally, generative safety is how we do business around here. I've been privileged to work with some major oil companies in the past, and they would, for example, be so all over any potential risk that there would be absolutely zero tolerance of that risk. And it didn't matter who it was that was using a mobile phone whilst they were driving. If it was a senior manager, they would still instantly be dismissed with absolutely no questions asked. It's very generative culture, but also at the other extreme, very much everybody committed to safety. So within culture then, it's a relatively enduring, stable and resistant to change. But, you can move things forward if you make changes to the systems that contribute to the culture. You can easily measure safety culture by looking at the safety rules and procedures. And what really kind of determines how safe an organisation is around the leadership commitment and their willingness to learn from the errors and collisions, a kind of a learning culture, a kind of culture that takes on board what they need to do to improve. So that leads us to our... Yes, Alan.
Just before you move on, there's an interesting question being raised by I won't say full names, I'll just say Mick, you know who you are, and I won't say the company, but there's an interesting question that says, do companies with large road user numbers have any legal involvement or responsibility in improving safety levels?
Well, yes. Now that's an interesting one. We do have the Corporate Manslaughter Act. There've been about 30 or so prosecutions, which is a shamefully low number. And all of those prosecutions haven't really focused on some of the fleet safety problems that we've seen. So it's a bit toothless, if you like. There's much more that can be done legislatively, but obviously, it is the duty of care within any organisation to manage the safety of people driving for work, and they are potentially complicit if they don't do so.
I mean, I'd also like to add on to this. I mean, having investigated many, well, not many, but several companies for, as Lisa mentioned, corporate manslaughter, this is one of the pieces of information which actually is used by investigators to actually look at whether or not an organisation is actually taking its duty of care seriously, which is the first sort of investigation, because any investigation has to actually look at, does a duty of care actually exist, and how seriously is that being managed? So what we do see is there are very, very few corporate manslaughter, certainly with regard to fleet prosecutions. However, there are a high number of health and safety prosecutions, because it's a lot easier to convict for health and safety legislation than the corporate manslaughter one. So I think, in answer to your question, Mick, alongside what Lisa has said, is that yes, that duty is very, very robustly sort of looked at. The health and safety executive are certainly becoming far more interventionist with fleet operations now, and aligning themselves much more with traffic commissioners. So we will see, I think, over the next few years, a much more joined up way of approaching these sorts of risks. I hope, anyway. Sorry, Lisa. Thank you.
Okay, thank you. And so this brings us to our first poll of the day, which is think about this question. When it comes to thinking about your clients, how would you think they would believe where they sit on their safety culture level? Do you think they would think that they were pathological, reactive, calculative, proactive, or generative? And then think about what you think, because sometimes there's a difference between what the clients think and what you think because of your experience with their claims and so on. So we'll be launching a poll to ask that question. How would your clients rank their companies according to safety culture level? And then secondly, based on your experience, how would you rank the same companies according to their safety culture as a general rule? Has the poll launched now?
Yes, it has.
Okay,
People
great.
responding currently.
Great. You're on mute, Alan.
Apologies about that. I'm muting because I've got a dog in the background. I do apologise to everyone. There's an interesting question from Val where she actually talks about whether or not a fleet of bikes would also be subject to the same type of rules.
Yeah.
And certainly, talks about we've all had to jump out of the way of speeding bikes and things like that, or delivering, whether they be food or other types of delivery. And certainly from my perspective, I'd be saying rules are exactly the same.
Yeah.
It's, a bike is a vehicle for the purposes of road transport. It may not be a motor vehicle, and there may be different insurance restrictions, but if you're operating in that environment, you've still got a duty of care for all employees, and therefore the rules are the same.
Yeah.
Got 161, 162 responses so far, Lisa, on the poll, just for information. So any last ones, please get it in quick. Right. I think we're about there, Lisa. Can you see the answers to the poll, Lisa?
Yeah.
Sarah, can you share the results, please?
Okay, sorry, Lisa. So in terms of the first question, the pathological comes in at 2%, the reactive 26%, calculative 29%, proactive 36%, and the last one, generative 7%. That was on the first question. And on the second question, I'm not going to read them all out, but the first category, 3%, 5%, and it seems like the reactive is sitting at 57%.
Okay, so it's very difficult to sort of judge those numbers, but it sounds like things are very different when you think about your experiences versus what the clients think. And it sounded to me on the first question that many more of you felt that the companies thought they were doing a good job. But actually, from your experience, they're not as good at safety than you would like to see. And I think that's kind of typical of what we see, that there is a big mismatch between what companies think they're doing. And I've seen this so many times, how talking to companies that they say, you know, we're doing everything we possibly can, and then you actually go in and find out from the people on the ground level that actually things are not quite how they think they are.
I think also adding to that, Lisa, I think when you start looking at how different perceptions are within their own organisation, that's one of the issues that investigators look for corporate manslaughter issues, because it's about communication. It's about actually ensuring that you're actually passing down this view for safety and expectation of safety. And I just ask you to think of, if you just ask you to the drivers in many of the businesses that you operate for, what would their view of that organisation be? And I think that's where we see probably the largest differential, I suppose, between the beliefs, as Lisa says, from those that are, you know, for want of a better description, at the bottom layer, through to those in middle and upper management, how they see the risk. And that's the first aspect of investigating a corporate manslaughter incident, because that separation of culture creates a first vulnerability for an organisation. Thanks, Lisa.
Okay, thanks. So what can we do about it? How can we actually set up within any organisation some of the interventions that we know from the evidence is effective at improving safety when driving for work? And I'm sure many of you will have come across probably the most popular way of managing safety at work is to have drivers be involved in some form of skills-based training, where they may go out with a professional driving instructor or an in-house driving instructor to perhaps do an assessment or be trained on the road on what they should and shouldn't be doing. And, you know, on the face of it, skills-based driver training sounds like it would be a great way of managing safety. So it's important, therefore, to sort of look at the evidence, and really there have been literally hundreds of studies on evaluating the impact of fleet-based driver training to see whether or not it really does help to improve crash rates. And unfortunately, it doesn't matter what kind of training your organisation gets involved with. All the published reviews, evaluations and meta-analyses, where they put lots of studies together and look at the overall consistent message through the results there, there's no effect of skills-based training on crash rates. And intuitively, you could imagine people here thinking, well, how can that be? Well, if you think about what happens when people are learning to drive, whether it be a professional in a professional capacity or a category B driving license, what they're learning are the sort of basic maneuvers, hazard perception skills, some of the control mechanisms that need to manage. But actually, when you think about some of the reasons why people are involved in crashes, most of them are due to things like fatigue, things like distraction, things like getting angry or being under time pressure. And these emotional and attitudinal and behavioral components of crash risks are not covered in the driving license systems. And it's clear that when you look at some of the evaluations, that after driving going through a driving test of some description, people are more likely to be killed and injured at that time than in any other time. So it's clear that there's something about the nature of that intervention that is not working. So that brings us on to our next poll, which is to really then ask the question, well, if skills-based training isn't particularly effective, unless, of course, there is a skills deficit, which, of course, it would be, what about other methods? How can you get people to comply with policies and procedures? What's the best method? So hopefully the poll will launch now.
Lisa, if you have a look in the chat function, you can see the responses coming up if you can't see it on your screen.
Oh, okay. Yes, thank you.
Sorry.
Okay, we've got responses coming through so far. Still getting a few coming in. So we've got the choice between disciplinary actions, fines such as being asked as a member of staff to pay for any excess on the claim, written warnings, remedial assessment or training where they're taken out on the road, and then telematics-based solutions and coaching. Okay. Very good. So we have 182 responses. So from there, it's clear. The clear winner is telematics-based solutions and coaching. And
I'll just interrupt you there, Lisa, because a couple of people have actually interestingly come back after the poll saying, prior to this webinar, would have chosen one of the other 4 options. So
yeah, that's right. And well, that's good news, because you're absolutely right. The majority of you have gone for telematics-based solutions and coaching, because really disciplinary actions can backfire. People often feel quite aggrieved if they're disciplined. Clearly, when they've done something wrong, there should be some form of questions around, what went wrong and what needs to be done. But it doesn't necessarily change people's behaviour. Fines, paying excesses on the claim. Well, the problem there is that it can encourage not reporting incidents because they know they're going to be blamed for it. They know they're going to have to finance the excess, so there'll be a problem there. And then remedial assessment training, we've already said that it's a check on their skills, but really it's not the skills that causes the problem. It's the way they use those skills. So the only real way that we can address driver behaviour really is through telematics and coaching. Looking at some of the issues around enforcement, many studies in this field, we have seen on some of the studies that the effects of enforcement are very short term, typically about a month, and certainly within 3 months people's behaviour returns to its former glory, if you like, and people continue to speed. Okay, so what I'd like to do now is, you've mentioned telematics-based solutions and coaching. Now I'd like you to answer the final poll of today, which is, what is the best way to use telematics for behavioural change? You've all completely recognised it's a good way of doing it, so we're launching the final poll. What is the best way to use telematics for behavioural change in your view? So just have the technology providing feedback to the driver in the vehicle, or perhaps on an app or on a website so they can check that information. Find the high-risk drivers and dismiss them, discipline them in some way. So you're using all the data coming through telematics to identify those people and target them for dismissal or disciplinary procedures. Train first-line supervisors using video clips and alerts so that you can coach drivers, or outsource that training to professional driver trainers. So those are your choices. Okay, we've got 182 responses, so that's pretty good. And we're starting to see the trends emerging here. And most people have said that it's the technology providing feedback to the driver in the vehicle, which is the clear runner, forward runner. And then the second one is train first line supervisors using video clips and alerts to coach drivers. So it's an in-house provision of that training. And then second is outsourcing, third is outsourcing, sorry. And then finally, find the high-risk drivers and dismiss them. So very interesting responses, thank you. And what is interesting is that 47% now have said that technology given in feedback in the vehicle to the driver is what they would recommend. Well, interesting. One of the issues with providing technology to the driver in the vehicle is the potential for distraction. That feedback being instantaneous can also be counterproductive in some regard, because For example, if you're penalised for harsh braking and you need to brake harshly, people might be reluctant to use the brakes. There have been plenty of cases where that's happened. People have tried to avoid using the brakes and actually found themselves getting into an incident. Generally speaking, providing feedback immediately after a journey is thought to have the most influential impact. But the problem with just giving feedback is that after a while, people tend to ignore it. And especially when it comes to an app or having to go onto some kind of website, it can be problematic. So there are some potential sources of problems with providing feedback directly to the driver in the vehicle. We would generally support the idea of training first-line supervisors within the company, because they understand the business really well. They understand their drivers really well, and they've got a much better kind of sense of what some of the problems are within the organisation, and have relationships with the drivers. So I'd be interested to hear, Alan, what you think of that. Some comments coming through about distraction, in-vehicle distraction.
I mean, I totally agree. I mean, can actually create a different type of emotion, so they can be angry at the feedback, and drivers can then focus on that and spend time thinking about that rather than actually what they're supposed to be doing, which is driving the vehicle. So for me, yeah, anything which actually can create that potential for distraction, should be resisted or should be managed better, because I think, yes, there is a place for instant sort of yes or no sort of indicators, but something which actually is quite judgmental, no, absolutely not in my book anyway. It's just too risky.
Absolutely. So generally speaking, telematics is a really positive thing. Combination, what the research says is the combination of coaching and feedback is more effective than either on its own. So feedback is important, and having that coaching alongside that is an added benefit. And certainly, we've seen in the studies somewhere between 20 and 30% are improvements in fleet safety through using that combination. So this is one of the strategies that you can use for developing a positive safety culture. And I think more than anything, we need to think about, how to put in place a structure around the systems that manage that safety in the workplace and when people are driving. And one of the ways of doing that is to make sure that people feel that they can voice their safety concerns, because by being able to talk about some of the problems that they're encountering, then they're able to say, well, this is a problem, this is a barrier for me to be a safe driver. We can kind of work together with the leadership and supervisors to actually discover what those gaps are and find ways to really strengthen those systems, to develop safety motivation as well, because when people feel heard, then they're able to feel a stronger connection to the organisation. One of the ways that you can do that is through insight training. Insight training is a theory-driven approach. It's really got a very long history, and it's only recently been applied in a fleet context. Essentially, what you're doing is trying to develop people's personal insights into their strengths and weaknesses as a driver, particularly focusing on establishing safety motives, because effectively what you're trying to do is change their perceptions of safety, change the way that they feel about safety, and develop goals and action plans that you can then follow up as part of your in-house training program to develop the people's ability to manage the problems of driving for work. And there's a strong evidence base here. I'm not going to go into the detail because we're a little bit short on time, but essentially what the research showed when you're, and this is a very robust study with 4 different types of intervention. One was on-road skills-based training. One was insight training, sort of classroom-based training, where the groups met for 3 or 4 times a year. And as part of that group, there was a commitment to safety and looking at some of the issues around developing insight. And then there was a campaign where publicity rolled out across the workforce, and then another one where there was a bonus when they were driving crash free, but they would only get that bonus if everybody was driving more safely. And the analysis looked at crash rates 2 years before that intervention, then the intervention ran for a year, and then looked at crash rates 2 years after the intervention. And what was particularly interesting was that the insight training intervention was by far and away the most effective and the most cost effective, because holding those insight training groups within the workplace was far cheaper than on-road training or, you know, giving out bonuses, or, you know, it was just literally much more cost effective. So what we're really trying to achieve then is a kind of an organizational commitment. And here we want employees to feel a connection to their organization, so that they do feel that they're part of they take responsibility for safety, whereby the employees feel that it's okay to tell the boss bad news about safety, and that it will be listened to, and that managers will feel that there's something that they need to do to manage that problem. And then by getting managers involved in the safety activity, then the workers feel like there's actually a good chance that the problem that they've discussed is going to be dealt with. And that kind of empowers employees. That makes people feel like they're able to contribute to safety. So people are all in it together, because safety is, you know, something that everybody has a responsibility towards. So one of the things that we can really do around this is to try and take a leaf out of the academic literature, if you like, and use some of that really powerful information for changing the way that organizations manage safety. And one of the things that SideDrive has done is to develop a CPC accredited program for truck and bus drivers, but of course it can be also used without the CPC element, taking all that best knowledge, the crown jewels from that research, and designing a 7-hour program which can be partialed up into 2 3.5-hour sessions, looking at 2 different modules. One is to look at what the safety system gaps are. So we get discussions around the room to find out what's going wrong, and look at people's safety motives and change the way that they see the situation, developing their driving insights using profiling systems. And then on module 2, actually design the strategies for safer driving, identify the barriers that might get in the way, and plan for some of the actions that they need to carry out in order to improve safety. And we use a profiling tool to identify the unique set of characteristics that each driver has that can identify those strengths and weaknesses, and through coaching identify what kind of targets, what kind of goals, what kind of issues need to be developed. So here it's about really making sure that people in this webinar have the right kind of understanding around human factors. And if you're interested in finding out more about human factors, you're more than welcome to join the accredited course. The Chartered Institute of Ergonomics and Human Factors have accredited this course. It's a 2-day online program, and there are 2 levels. Each level is for 2 days. In the first level, we look at some of the issues around human error, how to categorize human error, what are the reasons why people can make mistakes, commit violations, and information processing problems, fatigue and workload, how to manage road risk. And then in level 2, look at people's motivations and emotions when driving for work, stress, which, putting people under time pressure, what impact that has on driver behavior, why do people differ, and what are the behavioral change techniques that can be used from the evidence around what can be done. And so if you want to join me, you're more than welcome. We have dates coming up in June and July for level 1, and for level 2, the next course runs in April and also in September. Thank you.
Lovely. Right. Thank you very much for that, Lisa. What I'd like to do is just put out and ask people to indicate whether they want to ask any questions. While we're waiting for those to come through, Lisa, if that's all right, you mentioned about insight training and sort of ways to, I suppose, not change but adapt driving behaviour. Where do you see the things like the driver behaviour questionnaires, the psychometric tools fitting in that process?
So we've assessed literally thousands of drivers using these tools, and what you want to do is to develop people's competence around reflecting on their own personal thought processes around safety and why they do the things that they do. What would be a safer way of thinking about different situations. And you're not really going to get that information unless you profile people. Because when you're having those conversations with people, it's very difficult to structure around the different factors that we know are predictive of crash rates, like, for example, fatigue and time pressure and people's tendency to get annoyed and frustrated when they're driving. So when we are able to look at how people score themselves relative to a very large benchmark, then we're able to see whether they sit outside the norm, or whether they're about the same as the benchmark, or in fact more calm or less pressured than the benchmark. And that opens up a coaching conversation which is very bespoke to the individual. And that's really something that can be done through this kind of workshop training, where you can really get to grips with some of the reasons why people behave the way that they do.
Thank you, Lisa. I can't see anything that's come through particularly on the chat at the moment. So Niall, over to you. Thank you.
Yeah, of course. I think we might have had something come in right at the end there. Sorry, Mick, but I think we might be
just got it.
coming to the end of our time. But we will any questions that we haven't been able to answer today, between us, we'll make an effort to get back to you and answer those questions. So apologies that we have run out of time, and thank you all so much once again for joining, and thank you very much both Lisa and Alan for taking us through that today. That was a very informative and engaging session. So much appreciated to both of you, and to everyone else. I hope you have a wonderful weekend when it arrives, and hopefully we will see you very soon.
Thank you.
Thank you.
Thank you.